So we are very curious to discover if we can use different antibody-drug conjugates in series in the same patient, and we don't know if this is going to be possible. Now we know that Trastuzumab deruxtecan is going to enter the practice, but it's not the only ADC that has shown activity in HER2-low disease. We have at least two more. The first one actually was published was Trastuzumab Duocarmazine, which is also a potent novel anti-HER2 antibody-drug conjugate, which has positive data, for positive phase 3 data in HER2-positive disease, the TULIP trial, but actually showed also around 30 to 40% response rate in HER2-low disease. Few patients, less than 50 patients treated, but still telling us that this drug is interesting for HER2-low space. And another interesting drug is called Disitamab Vedotin, and this drug also has shown around 30 to 40% response rate in HER2-low. These responses in phase 1 trials appear to be shorter lived compared to Trastuzumab deruxtecan. Trastuzumab deruxtecan had a median PFS of 11 months in the phase 1 and around 10 months in the phase 3 that we have seen today, whereas these drugs have around 5 months of PFS, 4 to 5 months. So we're not sure if we're gonna see this benefit also in larger studies. However, I really think that there might be place for more ADCs, and this is also why we really need to study the resistance mechanism to these novel ADCs, and we are working on profiling the biopsies of patients treated with Trastuzumab deruxtecan, TDM1 and other ADCs to really understand what happens when patients progress. And this is going to be important both for HER2-positive disease, but also for HER2-negative or HER2-low disease, because apart from HER2-positive anti-HER2 ADCs, we have so many other ADCs coming. We have anti-TROP2 antibodies like Dana-Farber deruxtecan, Sacituzumab govitecan. We have Patritumab deruxtecan that was also shown to have a high response rate in breast cancer. So in the future, we're gonna need to understand if we can sequence these drugs, what is the best sequence of this drug, and to do this, we need to study the mechanism of resistance and understand what happens when patients progress to these treatments.